Mrs. Bond.
What?
Mrs. Bond, let's leave your catheter alone.
Oh.
Okay. Oh, here, let's put your
I have to go to
oxygen
the
back
bank,
on.
dear.
Okay.
I've got to go.
Okay,
I have
let's
to go
sit
put
back.
my checks
Let's
in.
put your oxygen back on.
I have to go. No. I have
Thank
to
you
go.
very much.
I have to go to the bank. I got to put my checks in. It's the rule.
Okay.
It's the rule. I
Mrs.
got to
Bond,
go. I have to go.
You are at
now.
the hospital.
No.
You're safe. You're okay.
Am I sick?
Yes, you are.
Oh, no.
Here, let's put your glasses back on.
Oh.
There you go.
One of the major issues when we talk about delirium in the older population is how common it is for us to not even recognize that delirium is there. And there's been, again, study after study that have demonstrated that as nurses, we miss more than 50%, sometimes 60% of delirium cases in the older adult.
In the following two scenarios, you will see two episodes of delirium. One in a patient with no underlying cognitive impairment, and the other in a patient with some signs of memory loss.
Good morning, Mrs. Bond.
What?
Good morning, Mrs. Bond.
Oh, I hear you now.
Can you see me where I'm sitting?
Well, I have trouble with my eyes. I see better on the side than I do out front. Yeah.
Okay, then I'll say sitting right here.
Oh, okay.
My name's Ashley. I'm going to be your nurse today.
Okay.
Now, can you tell me what brought you into the hospital?
No, not really. I must be sick.
Yes, the doctor thinks that you have a pneumonia, which is an infection in your lungs.
Oh,
Hopefully with a few days of some antibiotics, we'll be able to get you home.
okay.
Yes. Now, whereabouts do you live?
Well, I live with my daughter and her husband, and they have 3 children. That's where I live.
Good. Now, what are your 3 grandchildren's names?
I'm not too sure.
Now, I just have a few questions to ask you, some routine questions that we ask all of our patients in the hospital. Sometimes when you come into the hospital, your brain acts a little funny. Now, we just want to ask a few questions to make sure that that's not happening to you. Is that okay?
I suppose so.
Okay. Now, what year is it?
1975.
Okay. Now, do you know where you are right now?
Well, I'm in the hospital. I don't know which one.
Okay. Now, when's your birthday?
Well, I'm not too sure about that. But I know I'm old. I'm old.
Okay. Now, the next thing I'm going to have you do is count backwards from me. If you could, start with 20 and you work your way backwards all the way back to 1.
Okay. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10.
Ashley completes her assessment, and later Mrs. Bond's daughter arrives for a visit with her mother.
Well, the kids are asking about you too.
Oh, are they here with you?
No, they're at school.
Oh,
morning.
okay.
Hi.
Hi, how are you?
Good. My name's Heather Evans.
Nice to meet you, Mrs. Evans.
Nice to meet you.
Now, are you Mrs. Bond's daughter?
Yes, she lives with us.
Okay, great. My name is Ashley. I'm her nurse today.
Okay.
Would it be okay if I sat on your bed to ask you guys a few more questions?
Sure.
Okay.
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 Okay, thank you. So, Mrs. Evans, I was asking your mom a few questions this morning. I read in her chart that she does have some vascular dementia. I also noticed that occasionally, Mrs. Bonds, you had some trouble remembering some things. Right?
What?
This morning when I asked you a few questions, did you have some trouble remembering things?
Yeah, I did.
Okay. Now, is that normal?
Yeah, Mom's pretty forgetful, but she does fairly well.
I do good.
Yeah.
I do good.
You usually bathe yourself in the morning. We usually remind her.
So at baseline, then, you would say she was mildly forgetful?
Yes, she's pretty forgetful. She especially has trouble with names and dates.
Okay.
The grandkids'
I
names.
asked her.
Yeah.
I asked her what the names were, and she couldn't quite recall.
Yeah. You know, that reminds me, last time she was in the hospital, she got very confused. And the doctor said thought it could be a reaction to the medication. Do you remember that, Mom? Remember being a little confused?
No.
No.
Mrs. Bond.
What?
Mrs. Bond, let's leave your
What?
catheter alone.
Oh.
Okay.
Oh.
Oh, here, let's
Oh,
put
I
your
have to go
oxygen
to the
back
bank,
on.
dear.
Okay.
I've got to go. I
Okay,
have
let's
to go
sit
put
back.
my checks
Let's
in.
put your oxygen back
I
on.
have to go. No, 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 no. I have
Thank
to
you
go.
very much.
I have to go to the bank. I got to put my checks in. It's the rule.
Okay.
It's the rule. I
Mrs.
got to
Bond,
go. I have to go.
You are at the
now.
hospital.
No.
You're safe. You're okay.
Am I sick?
Yes, you are.
Oh. Oh, no.
Here, let's put your glasses back on.
Oh, dear.
How's that? Can you see better?
Yes. Yeah.
Hi, Chris. Hi.
Oh.
Mrs. Bond.
Oh, who are you?
Mrs. Bond.
Who are you?
My name is Chris.
Oh. I have
work
to go
with
to the
Ashley.
bank. I have to go to the
It's
bank.
okay. It's okay.
I got to put the checks in.
Mrs.
Yes, I
Bond,
got to put my checks
Can you
in.
look at me for a minute?
Oh.
Okay.
Oh.
Okay. Listen,
Oh.
you're safe. Everything's okay, okay?
Oh.
Everything's okay. Your daughter was just here. Okay. She'll probably be back in a few minutes. Okay. We just need you to calm down and relax for a few minutes. You're safe here, okay?
Okay.
Mrs. Bonds, could you count backwards from 20 for me? From 20 to 1.
20. 19. 18. I have to let the dog out. I have to let the dog out.
Okay,
Oh.
Mrs. Bonds.
Okay.
Oh.
Can you please try to continue counting from 20 for me?
20. 19. 12. 12.
Ashley, I brought a few things to see if we could try to keep Mrs. Bond safe while she's suddenly so confused, okay, because she's a fall risk.
Okay.
So what I did was I brought this reminder belt that we can put around her,
Okay.
and I also brought a walker so that we could put it in front of her in case she decides to get up when we're
Okay.
not here. So,
Okay, thank you so much for
okay,
your
maybe
help.
we can try to put that on.
Sure.
Bring it around the back. It's okay,
Mrs.
Mrs.
Bonds.
Bonds. We're just going to put this seat belt on you, okay?
Okay. There we go.
That's good. That's not too tight, is it?
No.
Okay. There we go. Okay. I want you to stay in the chair, all right?
What?
Don't try to get
What?
up.
What?
It's okay.
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 Mr. Fenn, 73 years old, has been admitted to the hospital with a broken hip.
Your surgery is scheduled for tomorrow in the morning, and our goal is to repair your hip as soon as possible because this helps to decrease your pain level and also it improves the healing process.
I see.
I want to ask you some questions because I want to assess your thinking ability because on this floor, and especially with what you've experienced with your hip, that your fractured hip, we like to monitor a patient's thinking ability as often as we monitor a patient's blood pressure. So I'm going to ask you some quick questions. Okay?
Okay, they did in the emergency also.
Oh, they also asked you these questions earlier. Well, can you spell the word world for me backwards, please?
World backward. DLROW.
That's perfect. And how about, can you tell me what's today's date?
Today is Wednesday, September 12, 2007.
Perfect. And can you tell me how long or how many hours you've been in the hospital?
I think it's about 6 hours now.
That's perfect. It has been 6 hours. And when is your birthday?
I will be 74 on November 2nd.
That's all the questions I have for you right now. I do want to let you know, though, expect to be asked these questions frequently, okay? Because, like I said, it's very important that we monitor your thinking ability. Still assessing that you are in pain. I'm going to be right back, and I'm going to bring you your pain medicine.
Okay,
Do you need
thank
anything
you.
else while I'm back before I bring your pain medicine?
No, thank you. You have been very kind to me. Thank you.
Hi, Mr. Finn. Do you remember me? I'm your nurse. My name is Aria. Mr. Finn, are you okay?
I think so.
Do you know where you are, Mr. Finn?
I'm in my home, but
Well,
it looks strange.
Mr. Finn, actually, you're in the hospital right now. Do you remember why you're here?
Why?
You fell at home this morning and you broke your hip.
I did? Why I don't remember that? Am I going crazy?
No, Mr. Finn, don't get scared. It is very common for patients to get a little confused and sometimes for their brain to get a little fuzzy when they're new in the hospital. But you're okay. Mr. Finn, can you please tell me the date today? What day is today, sir?
I think I'm thirsty. Can
Well,
I
you-
get some drink?
Yeah, you have some water right here. I'm going to help you to drink some. Mr. Finn, the water's right here, sir. Mr. Finn, can you tell me what your birth date is, please? When were you born?
My birthday. I don't know.
I'm going to ask you a question that I asked you earlier. Can you please spell the word world backwards?
World? What happened?
Well, nothing's wrong, Mr. Finn. Don't be scared. Can you please count from 20 down to 1?
Yes. 20, 19, 11, 15,